Postpartum hemorrhage, or PPH, is one of the leading causes of maternal complications after childbirth. It most often occurs within the first 24 hours after delivery, known as primary PPH. Our project focuses on reducing the health risks from this type when the mother is still in the hospital and can be closely monitored by nurses and OBGYNs. PPH involves a sudden loss of over 33 fluid ounces of blood, causing a sharp drop in blood pressure and reduced blood flow to vital organs like the heart, brain, and kidneys. Without quick treatment, it can lead to hypovolemic shock, a life-threatening emergency requiring immediate care. Most hospitals today use quantitative blood loss measurement to detect postpartum hemorrhage, where the amount of blood loss during and after childbirth is carefully measured. While this method is more accurate than visual estimation, it's still reactive. Treatment begins only after major blood loss has already happened. Additionally, current machine learning models for predicting PPH mostly rely on static factors like maternal age, BMI, and fetal size. However, they often overlook dynamic conditions that develop during pregnancy and labor, known as antepartum and intrapartum factors, which can provide crucial real-time insight into a mother's risk.
Our project focuses on addressing this limitation directly. We created a model which incorporates real-time pregnancy-specific data, giving healthcare providers a clearer picture of what's happening as it happens. We found a dataset which focuses on the antepartum and intrapartum risk factors for PPH. This was based off of a population specific to southern Ethiopia, but we were able to generalize the overall findings to our model. After filtering through this dataset, we had to focus on key components which would help indicate the risk factors associated with PPH. After determining the important trends, we were able to determine who would be at high, medium, or low-leveled risk. Using this model, we created a web-based application designed to analyze a patient's clinical data and help doctors and RNs estimate their individual risk for developing PPH. Our goal is to help healthcare providers identify high-risk patients earlier, enabling closer monitoring and more efficient allocation of necessary resources for preventing severe bleeding before it occurs. In order to use our website, doctors or nurses would open the website, input all the relevant patient data, and this data would be collected once the patient is admitted to the hospital for labor. After this data is inserted, the doctor will then click Predict PPH Risk. The action first verifies that all the entered values are valid and fall within acceptable medical ranges for each specific vital or clinical parameter. Once the data has been validated, the system generates a personalized risk score indicating the patient's likelihood of developing postpartum hemorrhage. Using this information, the OBGYN and nursing staff can develop an individualized care plan tailored to the patient's specific risk level. This would allow for earlier intervention and improvised maternal outcome.
Our business model has 3 main features that give us a competitive advantage. First, our AI is trained with PPH datasets with dynamic factors, giving us greater predictive accuracy. Second, we're pursuing strategic partnerships with EHR vendors and wearable suppliers, which will help with AI training and hospital adoption. Third, we have a first-mover advantage. Our 2-phase approach in hospital prediction followed by post-discharge monitoring addresses the complete care continuum that no current solutions offer. We have a head start on the AI model development, and the postpartum monitoring feature is valuable especially with the NMHPA. Additionally, we can offer flexible revenue models, allowing us to adapt to our customers' needs.
Looking ahead, we plan to enhance our model in several ways. First, we aim to include fetal ultrasound data like growth graphs and diagnostic images to capture a more complete picture of both the baby's development and the mother's condition. We also want to add physician notes and free text medical records, which often hold insights that structured data can miss, such as clinical impressions or subtle warning signs during labor. In addition, we're exploring secondary postpartum hemorrhage, which can occur up to 12 weeks after delivery. Our goal is to integrate real-time monitoring through wearable sensors that track vital signs of postpartum mothers after discharge. The model could then send automatic alerts to healthcare staff or caregivers if it detects a sudden rise in risk. By adding these features, we hope to make the system not just predictive, but proactive, enabling continuous monitoring and faster response to improve outcomes for mothers during and after childbirth.